My mom said that Aunt Jenny had the look today. What look is that? It's one quite common to a person suffering from the mental illness of schizophrenia. This look is when a person gets a sort of blankness to their eyes and stares through you or past you. According to the National Institute of Health's website, schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. Having been exposed to my aunt's condition throughout my life, I am well acquainted with the symptoms and treatments of schizophrenia. I am not a professional, but I do have personal experience. My aunt has become very violent with family members because of this disease. However, my mom has always made sure I am not around those outbursts. Now that I'm older, I'm interested in schizophrenia because of the impact it has had on my family. Schizophrenia is a diagnosed mental illness that does not only affect the person afflicted, but the family members also. It is a complex disorder affecting the mind and body in a complicated manner. However, there are some promising treatments for schizophrenia patients. I would like to educate you on these impacts of the disease on patients and their family members, the science behind the disease, and possible treatments for it. The first area I'd like to discuss is the impacts on the patient and their loved ones. Schizophrenia is a rare disorder less than 1% of the population suffers from. Most people are diagnosed between the ages of 18 and 25. When schizophrenia is active, symptoms can include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. This list was provided by the American Psychiatric Association on their website, psychiatry.com, in 2023. Many people think that people with schizophrenia have multiple personalities. This is not the case. They usually suffer from both auditory and visual hallucinations. One of the most prominent characteristics of this disease is hearing voices. My aunt has described it as a deep, scary voice that she cannot get away from. These voices often tell the person to do or believe something that is not true. And strangely enough, it always seems to be a negative or scary thing. In my aunt's case, the voices tell her that she's ugly or to harm or kill her mom. People with schizophrenia also struggle with the ability to differentiate between reality and fantasy. Schizophrenia also manifests itself physically. Patients with this mental illness often have unpredictable or repeated movements, sometimes leading to catatonia, which is when the person cannot move or respond to their physical environment. People with this disease also have an increased likelihood of heart disease and diabetes. Because of the severity of both the mental and physical symptoms, people with schizophrenia are often unable to hold down jobs or take care of themselves. This leads to a great impact on their loved ones and their caretakers. Their caretakers are mentally and physically taxed. They may live in fear of violent outbursts and may mourn the loss of a normal life for their loved one. My grandma has devoted her entire life to taking care of my 53-year-old aunt. She has sacrificed her golden years of having no responsibilities to ensure that her daughter has the love and care that she needs as a person with this illness. Now that I've told you about the symptoms of the characteristics of schizophrenia, let's discuss the science behind the disease. As I already stated, this mental illness is usually diagnosed in the late teens or early 20s. However, symptoms may be present but go undiagnosed earlier than that. Psychiatry.org noted that the early subtle signs may include troubled relationships, poor school performance, or lack of motivation. While these signs alone do not mean a person is likely to develop schizophrenia, they are notable if they accompany hallucinations or periods of psychosis. Healthcare workers strive to determine if the patient's symptoms are in fact because of schizophrenia. They usually require 6 months of symptoms as well as an extensive medical examinations to rule out other possible causes before they make a diagnosis. Other possible causes of these symptoms might include some substance misuse or neurological illnesses. Scientists remain unsure as to the exact cause of schizophrenia. It is believed that both genetic and environmental factors or life stressors may play a role in the onset of it. There's also evidence that brain structure can have an impact on development of this disease. According to medicalnewstoday.com, a 2018 study showed that people with schizophrenia have thinner cortexes and show the largest differences in their frontal and temporal lobes. Researchers continue to study the disease so that they may more effectively prevent or manage it. Even though scientists might remain unsure as to the cause of schizophrenia, they have been somewhat successful in developing treatments for those with schizophrenia. There are a variety of medications available to help combat the psychotic symptoms of this disease. Patients work with their healthcare provider to find a drug or combination of drugs that work best for them individually. There's often trial and error, as some medications work well with some people, but not for others. My aunt is considered an extreme case, and throughout the years has been put on many different medications. The one that works best for her is so toxic that she is required to have a blood test every 2 weeks to make sure she maintains certain blood levels. If these levels get too high, they can be fatal to her. Behavioral and cognitive therapies are also effective at helping to minimize the symptoms of this mental illness. Some of these therapy techniques are used to help the patient reduce stress, while others are used to support them in employment or social situations. In addition to medications and therapy, family support is also a vital part of treatment. There are organizations devoted to supporting and educating family, friends, and caretakers of people with schizophrenia. They provide valuable tips and suggestions for helping care for the loved one of this disease. In summary, schizophrenia is a complex mental illness that affects the patient as well as those in the patient's life. It is a complex disease that affects both the mind and the body, but there are promising treatments to diminish the impact. I have discussed the mental and physical impacts on both patient and loved ones, the science behind the disease, and possible treatments for it. An estimated 24 million people worldwide suffer from this disease. It is likely that you may encounter one of them at some point in your life. I hope you have found this information educational and interesting, possibly helping you to understand the illness a bit better.